Hi, today's video conference is a comprehensive overview of Down syndrome. By the end of this video, we hope to leave you all with a better understanding and raise awareness of the disease.
Hi, my name is Daisy Bernabe. I'm going to explain Down syndrome. What is Down syndrome? Down syndrome is the most common congenital disorder. It is a genetic disorder that causes lifelong intellectual and physical abnormalities. It can range from mild to severe. With education in school and good medical treatments, people with Down syndrome can lead full lives and be able to contribute to society. Many people with Down syndrome live happy and productive lives. For people with Down syndrome, the life expectancy has increased dramatically to 50 and beyond, but it depends if their case is mild or severe. According to the Center for Disease Control, it is estimated that 6,000 babies are born each year with Down syndrome. Most of the time, Down syndrome is not inherited. There are three types of Down syndrome. The most common is called trisomy 21, non-disjunction, and then there is mosaic and translocation, which is the most uncommon. Now I'm going to explain the etiology of Down syndrome. Down syndrome is caused by a mistake during cell division when the egg or the sperm were developed. It can originate from the father or mother. Chromosomes carry genetic information that determine how the baby will be formed in the womb. A normal baby would have 23 pairs of chromosomes, and in total there would be 46 chromosomes. With Down syndrome, a baby is born with an extra chromosome called chromosome 21. So as a result, the baby receives a total of 24 pairs of chromosomes instead of 23 pairs. Therefore, Down syndrome, there's a total of 47 chromosomes. In the first type of Down syndrome, called trisomy 21, non-disjunction, all the cells in the body contain that extra chromosome 21, which as a result there are 3 copies of chromosome 21 instead of the usual 2 copies. Therefore, all the cells in the body have a total of 47 chromosomes. The second type of Down syndrome is called mosaic. In this type, only some cells contain that extra chromosome 21 and all other cells are normal, and this happens after fertilization. The third type of Down syndrome is called translocation, and in this case, it is passed from parent to child. Chromosome 21 becomes attached or translocated to another chromosome, and as a result, there are 2 copies of chromosome 21 with additional material from the translocated chromosome, and this happens before or at conception. Another cause of Down syndrome can be the age of the mother. The causes of non-disjunction chromosomes are unknown, but research has shown that babies born with Down syndrome increases in frequency as a woman ages. There is a higher chance over the age of 35 years old.
Hi, my name is Heidi, and I'm going to be talking about the signs and symptoms of Down syndrome. The signs of Down syndrome include physical features such as a flat face, small slanted almond eyes, a large protruding tongue, and a round face. However, it is important to be aware that not all Down syndrome children will look alike or will have all of these physical features. Symptoms of Down syndromes include physical and intellectual disabilities and an IQ ranging from mild to moderate. Medical problems such as birth defects, hearing problems, heart problems, eye problems, and thyroid problems are also symptoms of Down syndrome. Down syndrome can be detected through screening tests and diagnostics tests. Screening tests includes ultrasounds and blood tests. Ultrasounds measure the amount of fluid that is collected in a certain area of the baby, which is usually in the neck area. This indicates that the baby has some kind of problem. The test measures pregnancy-associated plasma protein A, as well as hormone human chronic gonadotropin. Abnormal levels of these indicate problems with the baby. If screening test indicates high risk of Down syndrome, further testing is done to confirm diagnostics. At the 15th week, amniocentesis can be done where the needle is inserted into the mother's mother's uterus, and a sample of the amniotic fluid is taken out, and analysis of chromosomes are taken care of. Villus sampling is where the cells from the mother's placenta are taken and analysis of chromosomes are taken place. The test that is done is called the percutaneous umbilical sampling, where blood is taken from the mother's umbilical cord and examination of chromosome defects are being taken care of. However, we must keep in mind that amniocentesis has a 1 in 200 chances of miscarriages, as well as chronic villus sampling has a 1 in 100 risk of miscarriages. Percutaneous umbilical sampling, however, has a much more high risk of miscarriages compared to the other tests, which is why it is only done when the other tests are unclear.
Down syndrome has many treatment options so people can learn to live with this disability, since it is not something one can cure. Each treatment is specific to the individual based on the severity of their case of Down syndrome. One of the most important things is the patient needs to have positive people surrounding them who are encouraging and supportive and want the best for them. This can have a huge impact on the patient. When a child is diagnosed, there are many different health professionals that they need to seek immediately. Early intervention is beneficial to a child with Down syndrome who wants to live a good quality of life. Early intervention is to take place from birth to the age of 3. Because after the age of 3, many children begin school, and many school settings have programs to accommodate children with Down syndrome. The types of therapies that can be used to help the child include physical therapy, speech-language therapy, occupational therapy, which is teaching common skills, and emotional and behavioral therapy. The goals of a person with Down syndrome would include to make the best out of every day. Although research is allowing many people with Down syndrome to live longer lives, their lives are still cut shorter than others. Utilizing the various therapies available would help increase the quality of their lives that are shortened. One of the most important things a person with Down syndrome can do is remaining active after high school, because many programs are not available after then. That is why it's so important to have a supportive people in your corner, because they would allow you to have access to those type of things. And those type of things can include post-secondary education, employment, and even independent housing.
My name is Juan Sanchez, and today I'd like to talk to you a little bit about some of the goals that people with Down syndrome have, as well as some of the barriers they face when trying to achieve these goals. For people with Down syndrome, the common goal is to live a happy and fulfilling life, like it is for many of us. By show of hands here, how many of you would like to live a happy and fulfilling life? 1, 2, 3, 4. As you can see, we all share this common goal, and there's not much of a difference between us. The only difference is people with Down syndrome suffer from a genetic disorder that disables them from certain aspects in their life. Some of these barriers can be evident in facial features and other physical barriers, such as vision and hearing problems. People with Down syndrome tend to suffer from overwhelming amount of earaches due to structural abnormalities in the ear. These ear infections and earaches can lead to permanent to temporary hearing loss, but can most of the time be repaired through hearing aids and other vision assistance such as glasses. Another type of barrier that people with Down syndrome face are thyroid problems. About 30% of people with Down syndrome suffer from thyroid problems, and this can be very discouraging to the patient because it causes a hormonal imbalance in the body, which can leave a patient feeling tired and apathetic. Another barrier related to that would be sleep problems. A large amount of people with Down syndrome suffer from sleep apnea, which are short periods of not breathing during sleep. These short periods of not breathing can lead the person to sleep deprivation, which can also interfere with their learning capabilities, just as it would for any other person. Another problem with this would be communication. Due to the lack of motor skills in the jaw and other speech muscles, a person with Down syndrome tends to have a harder time expressing themselves. Although their receptive language skills are excellent, their expressive language skills lack a little bit. So, because of these barriers, a person with Down syndrome might have a hard time going through education. You might see a person with Down syndrome attempting to communicate, and her parent might say, he knows what he wants to say, he just can't put it into words. This can be a barrier in school for many reasons. Participation, social acceptance, and this can lead for the patient to lash out in certain compulsive manners. Some of the therapies that we can use for this would be language therapy. It has been proven through research that breastfeeding can actually help improve language skills in people with Down syndrome. So early intervention has actually become more popular. Another type of therapy would be physical therapy. Developing motor skills with activities such as walking, running, sports, swimming is actually a very big common one. These type of muscle development, muscle growth activities can help motivate the person and also give a muscle definition. Another type of therapy would be occupational therapy. Occupational therapy may be one of the most important because it puts the person in everyday life situations. So self-caring skills would be the most crucial. This would allow the person to be able to make their own breakfast, do their own homework, get out and just live life like a normal person. Thankfully, we have supportive services such as disability payments to help compensate with some of these extra programs or extra needs of the patient. Another great supportive service would be the Individual with Disabilities Education Act, which helps the patient in school and allows them to get the extra help they need to succeed. More than anything, the most important supportive services that we can offer to a patient with Down syndrome would be family support, church and community support, and social acceptance. There's nothing more that a person with Down syndrome would like than to live a normal life. And we can all help achieve this goal by socially accepting a person with Down syndrome, talking to them and making them feel like one of us.